We're back with the Merce to Merce report. This your boy Anthony. I got my homie, Big Dog, Big Steppa, Malik.
You know, big league, emo slayer. You know,
That demon time, baby. You feel me? So we're gonna
so
start this off like we always do. No medical advice. I feel like I have to say this every time because I don't know. Maybe we don't, but I know someone's gonna
pretty
try to
important.
catch our ass because that's fucking 2023 for you. Also, gonna be using explicit language if you haven't figured it out by now. Clearly, you're not listening. So today we're gonna get into more of what an LPN is, what the LPN does, and the difference between the LPN and the RN. I feel like a lot of people don't know it. Myself, I barely know it. So Malik's gonna be taking charge of this podcast, and then after that, we're gonna do the classic Civil War, the ER nurse versus the floor nurse. But we're also putting the ICU within the floor. Sorry, guys, you're not that special today. So go ahead. They always think, bro, it's a cult in the ICU. It's a good one, but it's
It
still a
definitely
cult.
is. It definitely is. And I ain't gonna lie, I worked around some ICUs and they're badasses and they're pretty chill. Like every time I go over there, they're like, "Yeah, when you come to work with us?"
Yeah, yeah, that's always a good
I,
sign. If the ICU is asking you to come join them, that means you're doing something right, because they don't take everybody, baby.
yeah.
So
All
let's
right.
go ahead and
On the
get
game
into it.
differences between LPN and RN. First, you got to understand registered nurse. That is when you say nurse, everybody thinks, "Oh, so you're an RN." No,
Yeah,
I'm an LPN. I'm a licensed practical nurse, or in some of the like Western states, Texas, California, things like that. They're called licensed vocational nurses. So the schooling differentiates time wise. And I say that's like the biggest differentiation because we go to school for 10 to 12 months in the actual program and you're out. You're done.
that'd be
You get
so
into that
sweet,
bag.
so sweet, dude.
That, it seemed like it, bro. But then you see that bread that the RNs be getting. I'm like, give me,
Yeah,
give me a check. You know,
yeah.
it is very technical, very hands on. We learn the exact same shit. So this is coming from I was in the ASN program originally. Did I make it through second semester? Felt that test by fucking this much, bro. This much, bro.
They should have given you
Transferred into the
reparations on that one.
oh shit. They could have helped me out. It's cool though. I understand. You know what I'm saying? You got to know these things. So I transferred into the LPN program. Graduated in 3 months. Like I won't say that it was easy by any means. It was definitely it felt tougher. I had to take content tests on things that I had to learn. So I had to teach myself the content test out of that content. You know what I'm saying? So I had to catch up and then keep up with the people that were already in the program ready to graduate. So it's definitely difficult. Um, Biggest things that I've noticed, and I think I notice it more here in Texas than I do in Missouri, is a lot of like other professions don't understand what we do, what our scope is, like how we're trained. Like for some reason, they thought that LVNs are trauma trained, like paramedics. And I'm looking at you, I'm like,
No.
what?
Yeah,
No, baby. We go to nursing school. We take the NCLEX.
yeah.
Like, that's not the case at all. We do a lot of the same shit. It's just there are certain things that are state to state regulated. So in Missouri, we can't push meds. Like you can hang antibiotics, things like that, fluids, and do boluses of meds that aren't that take longer than 15 minutes. Anything 15 minutes and under has to be done by an RN. So like your IV Keppra, I can't hang that. I can do a slap this 30-minute flagellan though. Here in Texas, we can't push meds. So I mean that's fun. I do a lot of IV Zofrans now.
Yeah. That shit's like
You
water
know,
in the hospital, dude.
I'm telling you, hey, listen to this though. So I've seen in Missouri a lot of the stuff was like over 2 minutes. You push a lot of meds over 2 minutes. Here, oh no, you get that little syringes out, friend. That's a 15-minute push.
What?
Yeah, brother. Yeah, brother.
What are you doing for
I'm like,
15
yo,
minutes? Yeah. Eh, eh, eh.
watching paint dry. Get a fucking syringe, let it run.
I don't think I
Pretty much.
could do it, bro. I couldn't talk to a patient that long just sitting there bent over or whatever, man. I might have to be
I'm just
sitting
looking at
down
him.
on
I'm
a
like,
stool.
oh, so you like stickers? But I mean, those like there are minor differences, but it really everything is based state to state and facility to facility. So some places you can do like central line dressing changes. Some places they don't want you to have that responsibility. So it's a lot of gray area as to what an LV and LPN can do.
Do you think that the faster pace? Do you think you like comprehended more or less than compared to like being a nurse? Because I feel like the faster pace, do they tend to skip over stuff, or do they just nail it all and you're just
No,
getting hammered?
you got to get that shit. There's no skipping over because we need to know the same base knowledge that the RNs do. It's just what we do in those situations are going to vary because either we keep it and take care of it or we escalate it. And
Gotcha.
I've worked with a lot of RNs that'll be like, Malik, you've been an LPN for so long. Shit. What am I doing here? What do I do in this situation? And I break it down to them. Like, I've been in these situations and I've done these things already. Whereas, like, a new grad RN, a new grad LVN, they're going tit for tat.
Gotcha.
You know,
Mm-hmm.
every year LVN, LPN to a new grad RN. I'm sorry, bring me my L's.
Yeah, no, I'm the same way. Experience, bro. I mean, it's the same way with doctors. You got certain doctors that'll listen to like a nurse who's been for a nurse that's been 20 years because they're like, yeah, this person probably and definitely knows more than me. So that's the big part. That's why like you just got to get through school because like after
Yeah,
that you can really take over how good of a nurse you want to be because it's just how
yeah,
much effort, how much time you're gonna like put yourself in those situations because there's plenty of times when you can just sit outside the room and not do anything, but like
hmm
you can also just go in the room, you can listen, you can offer to help out. Like that's where we talk about like just being a sponge, dude, because people are gonna want to teach people that want to learn versus like if you're sitting at the desk, why are they gonna come out of their way and be like, hey, this is something you should learn and then go through it versus if you're in the room, you're helping them, they're more willing to explain it to you after.
And see, I love to learn. I love like I don't talk much, but if you tell me like, hey, I'm gonna go do some cool shit, you want to go? See? Yeah, I want to see.
Yeah, I
What the
want to
hell?
see some
You tell me
cool
too
shit.
close. Like,
You know what
what?
I'm
Yeah,
here
I want to
for.
see.
That's all I want to do is the cool shit. I don't want to. I'll hold your hand, but I ain't trying to hold your hand for 12 hours, man. I'm trying to do some cool shit.
I want to get in and experience these things and learn more because ultimately, like we were saying about Big C, she was at LBN for a long time. Got in there, getting the RN school. That shit was cake for her.
Oh my
You
god.
know, it does help. It definitely helps. But I mean, I will say, I recommend if you don't need the money right then, you got the time, you're young enough, go ahead and get your RN done.
Yeah.
Because it's something else when you get in there and somebody has that RN and they're trying to hold that shit above your head, but you know you smarter than them. And you just know, like, bitch, I will eat you up.
I feel like you just get so limited, like
Yeah,
so limited as being an LPN. Like you're like, oh, I'm gonna move here, I'm gonna do this.
opportunities. The pay is not as good. You know what I'm saying? Some fields, some places won't let you work in certain environments. So like, there's not many places that LPNs work in the ER. You know, like it is more common here in like Texas and places where we have an expanded role compared to states like Missouri, where a lot of your meds are going to be IV push meds in the ER. You
Yeah.
can't do that in Missouri. You know, so hospitals are not as willing to let you onto those floors. I
Mm-hmm.
will say the last one I worked at though, they had expanded. There was LPNs working in the ER. They were working in the ICU by the time I left too. So it's like,
Yeah, I
you
mean, we
know,
finally got a tech in the ICU, but I don't think there's any LPNs, and I doubt they put any LPNs. But that's rural facility, like rules. They only have so
yeah.
many options. Like, but okay, then
Say because I went from a level one trauma to a level two, so it's like not a
yeah.
huge difference, you know.
But do you think like missing on patho and microbiology, like as we talked off episode, do you think that really
Mhm.
affects you as a nurse, or do you?
I don't, I don't, because like I was saying, a lot of programs don't require that as a prerequisite, you know, like
I think
some
most of it
programs,
you just have to learn on the job too, because like,
yeah.
man, I couldn't tell you really much. Like yesterday, I gave 3% normal saline 3%, and you should have seen me trying to explain that to the patient what we were doing, because I even had to ask the MP the whole time. Like, look, I've never done this, man. You're gonna have to explain this to me. We're gonna take this nice and slow, because all I know is that it can fuck them up real quick, and then
Real quick.
and there's not really much going back. Like coming, you can raise it or you can lower it pretty fast, but like you
uh,
can't, not fast enough to save their like. Once they hit that switch, dude, they're gone. So, but all I know from micro is
you know,
Osmosis Jones, dude. That's it. That's pretty much all I remember. Just watching
micro
Osmosis Jones.
teacher, bro. I enjoyed micro. I forgot like what did I get in that class? Like 89, something like that. You know, and I'm like, micro. I'm like, okay, it's cool.
Yeah.
Pathophys, I like that class too. My teacher was cool as shit.
Yeah.
Like,
So
I'm taking those classes. That's why I know it's like, you don't necessarily need this shit right now. Like,
yeah,
I understand if you want a big assignment and shit, like, no.
I
You
couldn't
know,
tell you much about like pathophysiology. Like I took that in the bachelor's, and like I
yeah.
barely remember that class. I barely remember anything. So like,
That was a requirement for a lot of the bachelor's programs I looked in. So if you're going to a BSN, that's something that I would expect to take things like statistics or calculus for life sciences type shit, you know, or with your patho and your microbiology. But I had taken those classes and applied to some LPN and RN bridges, and they
mm,
told me they wouldn't accept those as my science credits.
that would piss me off.
You know what I'm saying? So like, come on, don't shit in my cereal. Here I am. I know all this shit. I worked hard for these classes, and you telling me you won't take it?
Yeah, I know,
Like,
dude. It
no.
gets ridiculous with school, man. Like just like it just
Mhm.
feels like they nitpick so much, and like, well, one, they're a business, dude. They can say they're a
Yeah,
school, but it's a business, so they're trying to take
that's
all the money
definitely.
they can from you.
Oh yeah,
Like that's one of the reasons why I didn't transfer is because I was gonna have to restart the program all over after I was 1 year in. I'm like, look, I just need like
yeah.
another
No, it's
year or two,
not.
but
Uh-uh. See, I was doing some history and stuff on the LPN position and things like that. That came about right there before, like, was it the Crimea War? It was like late 1800s, just to fill the void of having like registered nurses.
I would say
And they weren't
something
even
like
called registered nurses back then. It was like, so it was just like a licensed nurse or something like that, you know?
it sounds better than an RN, dude. RN just sounds like I got on the website and put in my name versus like licensed practically. Like at least you got a license, you know?
See, but this is the thing though. Like, we go through the same board. We take the NCLEX, you know what I'm saying? We're regulated by the same nursing boards. You know, like we just have like a different set of rules.
Yeah.
I mean, and that's per state and per facility. So like there's so much gray area on the state board sites that facilities have to come up with their own set of rules and tell you what you can and can't do. You know what I'm saying? It's so annoying.
Yeah, like yeah, I work in rehab. I have to sign off on their care plans. I'm like, I haven't even taken care of that patient all day, and you want me to just be like, "Yep, this looks good." Like I don't have time to take care of 12
One major
patients.
difference I like that you'll notice between facility and facility. At the one that I was working, the med tele unit I was working on, we couldn't do care planning. We could put in interventions, but we can't touch the main care plan.
Yeah, dude, make it make sense.
They don't like stuff to make sense. They like differences, and wherever they can save money, they gonna do it. Because where they're hiring you for 30 plus, 40 plus dollars an hour, they're hiring us for 15, 20,
Ooh,
$25 an hour.
fuck that,
Bro,
dude. I would not be an LPM for
doing the
15, dude.
same shit.
Yeah, there's no way you can't do that. Dude. You can't fucking half price and make them do all the same shit. Because then most of the time they end up doing more work. Because the nurse is like, well,
Yeah.
I have to hang this and I have to push this, so I need you to go do one, two, three. And it's like, all right, this seems like some hoe shit to me.
Well, what it is like that's that tit for tat shit. Don't come thinking we finna just trade off shit because look, this is not within my thing. You know what I'm saying? So
Mm-hmm.
okay, cool. You got an antibiotic. If I need you, I'll come over there and be like, hey, can you go? Can you do this for me? You know what I'm saying? I'm not gonna just offer myself to go hang your antibiotic. Like, if you want me to, then ask me to. That's the thing that I run into a lot now, though. It's where they don't know what we do or how we're considered at the place that I'm at right now. So a lot of times they'll think that we do the exact same thing as like paramedics.
Uh-huh.
I am not a paramedic. I am not trauma trained.
You mean you
Do
don't want
not
to be
come to me,
intubating people, baby? Come on, bro.
bro.
Just throw that ET
I'm a
in there.
badass, but in my own way. You know what I'm
I
saying?
can't believe paramedics make what they make, dude. To me, that's ridiculous. I'm like, they look like they. To me, they almost more can physically save a person than an RN can, bro, because they can
I have an
intubate.
associate's degree. That's an associate's degree.
Like I don't know,
They
you
have a
could.
degree. I don't even have a degree. I got a diploma. They have a degree.
If you could intubate somebody, you should not be making less than $20 an hour. I'm sorry,
I
bro.
don't
Ain't
know.
no way. I don't care how much downtime you have, because sometimes they don't even
Yeah.
have downtime, bro. Like that's such a bullshit myth too. They'd be like, "Well, you get to sleep." I'm like, bro. Some of these people just be running nonstop for the 24
Yeah.
hours or however long it is. Like these, they come in looking rough in the ER sometimes. I'm like, damn, bro. Like,
See,
yeah.
and
Don't
I
put me
noticed
down for that one.
like a true ACT, like a true advanced care tech. So like I will do all your tech shit until you need me to do something nurse wise.
Yeah.
You know what I'm saying? And I feel like that's you're kind of shitting in my face. Like, I don't like it. You know what I'm saying? They're expanding our role right now though, so it's gonna get better. I'll be doing more like strict nursing based things, taking patients and stuff like that. But like right now, I chill in the back and wait on you to call me because you can't get a line or you need hold help or you need a patient transported. Like
I
I'm
think
more
about
than
that
that.
too, dude. Like just like they already make you do like CEs, whether like your state requires it or not. Well, like because Missouri, like they don't require CEs, but our work has to give us so many hours. So either way, you're
Yeah.
doing it, whether it's through work or like workforce or at like you get the opportunity at work. Like that'll fix the crisis right there in the nursing shortage. Just fucking make them take like a 2-3 month class or something. Like
Hmm.
and then boom, they
Find
can
a way to advance us without having to go through all that damn schooling again.
yeah, because don't be trying to fucking
Programs
take more money
here.
from us because you guys fucking run a shit
Yeah.
place.
When we go sit in these classes and you're going over the same shit that we've already done.
Yeah.
Like nothing changing other than the delegation standpoint and a couple skills that we're now able to do that were actually already taught to us because if something's fucked up, we have to notice it.
That's what I hate, dude.
like, like,
That's
bro, how many floor nurses you know can go in and start a peritoneal dialysis without blinking? Thank you, thank
yeah,
you.
I know how to turn it
When
off and
that's
unhook it.
that bitch up, I get it rolling.
yeah,
You know what I'm
dude.
saying? Like,
I think we have a dialysis nurse, bro. So they just come in, they hook them all up, and like I said, it's literally my job. And then you know what blows my mind? They're like, "Hey, if it just starts beeping, bro, just shut it off." And I'm like, I'm not gonna do that. So
long-term
I'll be
nursing
calling you
care.
at 4 in the morning, 3 in the morning. I don't care
Yeah.
what time it is. Hey, dog, the shit's beeping.
Yeah, no, I have to. When I was working in the skilled care units, I'd have four PDs going at once. And notice these take 40 minutes to set up, bro. Like, this is not no quick, easy go in, push a button. Fuck no. And this shit's sterile. The door's closed, mask on, gloves on, bib on. Like, you know what I'm saying? Like, we in the mix.
yeah.
Don't come back here messing with my lines either. I'm on your ass.
That's what I give all my props to the nursing homes, the psych units, and the rehab, baby. I couldn't. I don't got the patience for that shit.
I'm telling you, it's a whole different beast. Like,
It
I
gets
learned a
so
lot
hard.
in those places.
It gets
Like, I can't speak for every LPN, LVN, but like, we be knowing our shit.
yeah, dude. There's some of them that blow me out the water. I don't care.
I'm
Like
telling
they
you,
just
when you know your shit, you
yeah
know your shit.
yeah
Some people just don't have those opportunities to sometimes go back right then and there. Sometimes they need to wait, you know what I'm saying? Get life outside of work together. That way they can work on becoming like a higher role, you know what I'm
mm-hmm.
saying? But there's not, I'm not going to look at an RN ever and be like, oh, you're better than me. You got to show me some shit, shorty.
yeah. But let's see. I had a question. I'm losing it now. How long is the bridge program between LP and the RN? Like, is there anything else in there? Like, I know you
Normally it's 10 months and it's those same set of classes that you already take.
and then
So
you just
like you're
pop right
fucking
over. Like, do you have to do any
literally,
other tests before you pop over, or no?
you have to retake the NCLEX, but you take the NCLEX RN instead of the NCLEX LPN.
That would fucking
Which the major difference in those, like I'm saying, is delegation, a couple skill sets. That's it.
yeah. Yeah,
Because we take the same thing. I got a lot of EKGs on mine. I had a lot of L&D, ethics, fucking multiples, psych. Like we go over the same shit, bro.
do you guys think you need the full year coming from LPN to RN? Because I'm pretty sure, what was it? For us to get your associates from the LPN program was like a semester and a half. But I don't even know how long they were in LPN school before they came over.
10 months.
So they did
10 months. They go through summer and everything.
10 months. Pl-
And then you also have prerequisites. It's about the same amount of time, bro.
Okay, yeah.
Because you don't just roll into an LPN program with no prereqs. You have to take prereqs. A&P is like so
Yeah.
A&P nutrition, and then depending on where you're at, sometimes they make you take like med calc if it's offered separately than in the nursing programs. Like yeah,
So you guys basically just have like an extra summer between like coming in as like a fresh
hmm
nothing into RN school because what I
hmm
did 2 semesters as prereqs before I got into RN school.
yeah.
You remember taking that
So the
fucking test, dude? You had to
which one?
the entrance
The
exam, bro.
entrance.
Why the fuck are they putting mixed fractions on a fucking entrance exam, dude?
You know what I did when
That
I was
murdered
like,
like fucking half the people that lived on campus that went into the RN program was that fucking mixed fractions.
went
The
in there
only
shook like a mother, bro.
the
I
only
sat
reason I
there.
passed that is because I knew beforehand my ass is YouTubing how to do mixed fractions from fourth grade.
Yeah, I'm the same way. See, but I looked at it and I was like, oh, this shit just like the map test.
Yeah,
Like the Missouri standard test that we had to take. It exactly the same, bro.
yeah,
So I was like, oh, cake word, not word.
yeah. My ass still couldn't
Person's cool,
read. I was struggling with
bro.
that reading
ASN's
shit.
cool. I just feel like I didn't appropriate my time the correct way. You know,
Oh, for sure you
that's
didn't. A hundred
because there's
percent.
no way. You know what I was on. You know,
Yeah,
so,
you
like,
were having way
you know
too
that.
much fun. I'm trying to tell him like, hey, bro, I think you're having too much fun. You're like, nah, and I'm like, okay, you got it, buddy. But
Not
I'm telling you, you're having too much fun right now.
living you learn.
Wise words from Brian.
Yeah, yeah. But I mean, shit shakes out. You know what I'm saying? So, but I don't like having people with any sort of thing above me, bro. Like, I don't like going to work and a motherfucker can tell me what to do for real. Like,
Yeah, see, I
but
don't. I look at them. I don't really see any different, dude. Like if you're an LPN, you're on there. I'm like, cool, whatever. Like if you know how to do your
yeah,
job, you know how to do your job. I don't know.
man.
I know that's
I've
not a
noticed my thing
popular
is like,
opinion, but it's like, I mean, who would you rather have nobody there, and then
yeah,
you got to
I'm
take
not
four more patients?
work shit on you though. Like, that's the thing. You know what I'm saying? I've worked around a lot of RNs that try to look at me funny because I'm an LPN.
Yeah, it's so
Like,
ridiculous.
are you okay? Like,
And be the
if you
same.
don't understand, that's one thing. Like, you're ignorant.
Yeah,
But to be willfully ignorant is a whole different story.
and
The
those are the same nurses that complain that they got to take two extra patients because we're short staffed. Where it's like, here's your fucking.
nurses that I seen going in the room looking around like, oh, what the fuck am I supposed to do? And I have to come behind you and clean that fucking mess up. Fuck, get your panties out your ass.
You got anything else about the LPNs? I told you I don't really know shit, so this episode helped me a lot. I'm gonna be
I mean,
making
but
you
like,
do a lot more shit. No, I'm just kidding.
fuck yeah. I mean, there's my thing is like, what's the difference between not being able to do something, like allowed to do something, but knowing how to do it, you being able to do something, but not understanding how to do it.
Yeah,
You know, that's basically how I look at it a lot of times. Like, I know what the fuck going on. I'm
yeah.
not, don't look at me like I'm stupid.
That's why you can learn from anywhere, dude. Like even text, bro. Like text will teach you all the fucking tricks you need to know, dude. There's a tech. I probably been there, fucking been a tech. I don't know, more than half my
Hmm.
life, almost. Those kind of people that just been
Yeah.
doing it for like over 10, 15 years. She's talking about like, oh, you don't know how to clean people's nails because we were talking about how people have got poop under their nails sometimes. She's like, yeah, you just put the alcohol swab right on a spoon. That way you don't cut them. I'm like, fucking genius.
Because a
I
lot
would
of
have
people
never
be
thought
trying to
about that shit.
wooden, they try to use the wooden cleaners. No, don't use that.
Yeah.
You fuck that shit. No,
You
put it on
can't
the
use the
spoon, okay?
metal one because you cut the fuck out of them. Now you're in trouble. So, yeah, bro, you can learn from anybody, man. Just be willing to learn, dude. That'll make you the best nurse you can be. Just the willingness to keep learning, dude.
Hmm.
Because like you don't know
Definitely.
everything, bro. You went to school for 3 fucking years. You don't know shit.
And I'm telling you, bro. I met some looking at them.
I
I'm like,
still
I've been
don't
a
know
nurse.
everything. That's the main reason I don't want to charge, dude. I don't want to charge till the day I no longer have questions, and I don't think that day's ever gonna come. So I don't want to fucking do it.
Bro, you can run that shit. You can run circles around that motherfucker, bro.
No, fuck that.
I know you
I
could.
told you,
You might not want the streets, bro, but you can do it.
I'm a meathead, man. I am the blue collar nurse, bro. You just work my ass off. I'll take care of everything.
Side note, the boys was frying me because you know what we are as nurses, like what we're considered?
What?
Pink collar. Yeah. I was like, that's a thing? Yeah. They was like, yeah, pink collar ass dude. I say, yeah, fuck y'all. All right.
Yeah. Hey, it's not my fault. I already knew I couldn't work outside, so I knew I had to go to school, man.
You say you gonna burn up.
Yeah, that's funny as hell. Pink collar, because we got a doctor who wears like he's got a hot pink jacket, dude. I'd be giving him a time like, bro, where you going? Labor and delivery? Come on, bro. You look like an L&D nurse right now. Which,
Hey,
hey,
about figs though, you know that motherfucking expensive.
yeah,
Hey,
it's just funny as hell. I told him I'm gonna buy him a set of pink scrubs one day so he can wear those.
they just rolled some out. You can get them $87 for the set.
I'm a Walmart scrub buyer.
Oh, I love my figs.
They sell scrubs in the husky sizes, so that's where I shop at, bro. Them figs be trying to form fit. I don't want you to see my form.
Can't form fit my short ass. They need to make small petite or something.
Uh,
Like my legs a little too short. I might feel it in the thighs, but I got a little space around my ankles.
I don't I love being over 6 feet, dude. Being under 6 feet just sounds terrible, man. I don't know how you do it.
It has its pros and cons. Like whereas you have to get down, get low to get in like the little lower cabinets and shit. I don't have that worry, bro. I just drop down, grab the shit, and
We
get
already
up.
talked about this. The hospital needs to put better, faster fucking engines on those beds, bro. That shit, I mean, and then you got to work with some short ass nurse. She's like, I can't lift up here, and I'm like, I don't know, grab a stool, but my fucking back's on 10, lady.
Shit, I drive the beds like up high like this because they steer better. Because when I go down low at the hip and shit, no, it's too low. Bring that bitch up. Let me.
That cracks me up. We have so many nurses where I work at that literally need two people to go pick up a patient, and they're like, "Well, I just can't steer the bed." I'm like, "It literally has steer mode, and it doesn't weigh that much, bro. Just push the
No.
thing." I think that's just an excuse for them to little chit chats. I don't care what they say. You're never
But
gonna
on
get
that
it
note,
that you need two people. I've seen these little fucking ultrasound and CT techs. They move these people all night long in the ER just by themselves.
shit, I've seen RT pushing some shit, and I'm like, yeah.
Bro, the one time I had what an IV pull, the bed, and something else all in my hands, and I'm pushing this person because we didn't have enough people to go with the ventilator and all this shit and make sure someone's
Yep.
dragging. I'm like, it's not that hard, bro. Just figure it out. Just get it done.
Mm-hmm.
It don't
I'll
always
get
gotta
the
be
stuff.
pretty.
Like I'll raise the bed high enough, I'll stuff shit up under it because like if we have to take if they're on oxygen or anything like that, we have to take a transport box, suction, all of that shit anyways.
Yeah.
So like I'm making space. Fuck what y'all talking about. Sometimes I have to take the whole fucking monitor off the wall because they don't all have the
You
little
don't got the
screen
little
disconnect.
No, you
Bro,
got
no, I gotta take the whole bitch off. Yes,
you carry one of the old TVs with you, bro. Fuck that.
I'm telling you, like one of the prison TVs, the clear box.
All right, man. All right, let's get into it. Give me one or two differences that you know between. Because where'd you work at? Med Telly. When you
Med
went
Telly
before?
for a year. Yep.
And then so was it Med Surge and then Telly, or was it like did you take Med Surge patients, or was it all just cardiac patients?
Bro, I barely ever saw any orthos. I did take we took med surge, but a lot of our people were like fresh stroke, fresh cardiac.
Okay.
Yeah. Then a lot of the stroke patients,
Yeah.
a lot of sepsis patients. But we had a respiratory emphasis. So that was our main focus was respiratory. Because I
Okay.
did BiPAP and Airvo. We were the primary COVID floor. So I had COVID, RSV, human metapneumovirus. Like,
Yeah.
if it fucks your lungs up, I'm seeing you.
Okay. And I've worked all over. I worked Med Surge, Med Telly, Step Down, which our Step Down kind of feels like a progressive care unit. That's I don't know.
Yeah.
They were supposed to take a lot more. I don't know what the deal is. I'm not complaining. I just worked there, so.
Yeah.
I'd say one the biggest thing are your ratios. Like ICU, you got 1 to 2. It's so sweet, dude. Having two stable vents, not gonna be a bad night.
Yeah.
It's when they go unstable is when shit gets crazy. But like our step down, I think they're 1 to 3. I don't think very rarely they go and take 4 patients. I'm like, bro, so that's why I like working step down. I mean, you got a continuous BiPAP. Well, it is what it is. Most of the time, they're barely awake enough to take that bitch off or need anything.
Yeah.
And like med surge, I've taken 7 there, but that was only once. Normally, you only take like 6, which isn't too bad. The rehab's about the same.
Nice.
Med
Must be nice.
Med Telly, I have never taken 6 up there, I don't think, or maybe once or twice. Normally it's like 4 or 5. They're getting a lot better about staffing that floor, so that helps. I got a shit ton of travelers in there right now, so
Yeah, we were royally fucked. Yeah. 1 to 8 patient ratio, constant.
That's just too much charting. It's not even the work. It's just so much charting you'd have to do.
I wouldn't get done with meds until 1:30, 2 o'clock in the morning most nights, bro.
Bro, kick it into second gear, man. What do you do?
Bro, I'm kicking my ass, bro. I'm tired, bro.
Yeah.
I'm tired. That shit was crazy though. Like a lot of the shit that we handled and the way that shit was set up, we honestly should have been a step down. Like there's no way.
And is this COVID or non-COVID? Like, is this with, like, did you work there during COVID
I would
and
have
before, or just during?
towards the end of COVID.
Okay.
Towards the end of like the main push of COVID, but you remember I took that travel contract and stuff too. So,
Yeah.
but when I got there, we still had a lot of COVID rooms, COVID patients, and then everything else started popping off too. So it's like I would hate when they would split me like this. So I would have three COVID patients over here, and then I'd have another set of patients over here.
Oh,
I know, put all of my shit in the line. If you got to give me 8 straight COVIDs, I don't give a fuck.
yeah,
Give it
I'm.
to me.
It's just like because what it, yeah, like you feel like you can hear from outside the room versus if they're on that opposite side of the unit, dude. You ain't
Mm-hmm.
hearing shit because like that's what happened when I worked in Illinois. It was like a. It was like the
Mm-hmm.
outline. So you had like they came down the rooms this way, and then there's a little walkway in between. But if you have
Mm-hmm.
them on both sides, forget about it. You ain't hearing nothing over there.
And that's why I would do constant rounds. Like I'm not sitting down that much. Like I'm gonna finish my main shit, my primary stuff. So I'm gonna get in, get report, look at my patients, assess, pass my meds. Whenever I finish that, I'll sit down, chart. I will get back up, and I'm rounding on my patients again.
Yeah,
Cause I'll be damned I don't catch you. Cause
yeah.
you know how many dementia patients I would get up there with COVID, bro. Why are you getting out of bed at 4 o'clock in the morning? Where are you going? You can't walk.
They're
Your
like,
hip is
I
already
need to
broke.
take the car to go get Sally from the grocery store. You're like, no, you don't.
No. And
And
they're
like,
saying something. I'm like, they'll be here in the morning. They
yeah,
say you got to get some rest tonight. They'll be here in the morning,
yeah, I'll be lying like a motherfucker to those people, man.
bro. Got to
It's
sometimes. I hate it,
hilarious. Yeah,
but I mean, you got to. Shit.
yeah. They'd be like, "Are
I
you the
just want.
doctor?" I'm like, "Yes." Doctor said to sit down and don't get out of bed. They're like, "Oh, okay."
Just tell them no. I tell them no, but the doctor sent me here to watch over you.
Yeah.
Oh, okay. That's very nice of him. Yeah,
No,
yeah, it is.
they just think because I'm a dude, they're like, "Oh, you're a doctor," and I'm like, "Whatever you need to just be
Not me,
calm."
bro. They look at me, and for some reason, all my dementia patients think I work in the kitchen. You bringing me dinner? No, I'm not. It's 2:30 in the morning. Like,
Hey, they be getting a little racy with that dementia, huh?
oh, get me some crackers. I've heard some shit now. We talk about that on one of the long-term care episodes, brother. I mean, the major thing that I've noticed transitioning from med tele to the ER though is the workflow.
Mhm.
It's definitely different. So a lot of times on the floor, I'm like, why the fuck they sending me patients like this? They didn't take the time to do this, this, or that. They didn't even hang the fucking antibiotics. And now I'm down here and I'm like, yeah, I'm not hanging that shit.
Yeah. Yep, that's me, baby. I be playing both sides. I'm like, look, when I'm down in the ER, yeah, I ain't doing that. I ain't got time for that. I'm trying to do this, this, and this. I'm up there. I'm like, man, these lazy ass bitches ain't doing shit down there. They're not even gonna bring their patient up. Fuck this, dude. Fuck them. Yeah, no, you got to play both sides, bro, because like you don't have the time. But that's the biggest problem between the two. Like, we'll talk about my solution to fix it all, but yeah, I think like ER, you really got to work on like prioritization. Like, you got to be
Mhm.
like, okay, like who? It's almost like who's gonna die first,
Literally.
and then
Literally. We
versus
work on ESIs. So,
like the floor, you're like, okay, I have to get all these meds passed within this hour. I have to get to this dressing change, and I have to have it done in these 12 hours. It's like it's a lot more of like just kind of following orders than like almost predicting and choosing where to go.
yeah, definitely is. It definitely is. And I think just having like better habits when you're on the floor definitely makes that timeline a lot better. So like I knew that I was coming into a 1-to-8 ratio. I'm coming in, I'm getting report outside these rooms. I'm putting eyes on these patients right then and there. That way when I go back to my computer to look over your meds and stuff, I can go in, patients doing this, patients been seen, you know what I'm saying? I'm putting a timestamp on me, putting eyes on you.
Mm-hmm.
And from there, I like check lists and shit. Like I write my list.
Yeah,
Like I fold my paper into squares and shit, and I write so and so, this room, these are the meds, you know what I'm saying?
mm-hmm.
And I do that for all my rooms. Then I go through room to room, meds. I finish up your meds and your assessment, your big assessment, go back to the med room, grab the next one. And I just roll through that way until I'm finished.
Yeah, yeah.
So it's just really having those good habits.
Let's see what else. I think on the floor, like you really don't need to be a team. Like
No,
ICU is
you don't.
different because like you can, like I said, you can have two crashing patients and you can't be in both rooms at the same time. But like I don't know, man. Just my opinion. Working med surge, med tele, I could go sit down the hallway and not talk to
Yeah,
anybody and take care of
yeah.
all five of my patients by myself. I'll do the
We would
tubes.
do
I'll
that.
do the
Yeah,
vital signs. I'll take them to the bathroom. But I also don't
yeah.
make like I don't mind someone having to wait to go to the bathroom. Like I said, that's where the ER starts to play in me too much. I'm like, Look, man, I know you got to pee, but this person's already up, and so you're just gonna have to hold it. Like, and I feel like that's a normal thing that they've been
Yeah.
trying to take away now at the hospital. They're like, nope, that's not a thing, and it's like, look, dude, we only got so many people, so yeah, this ain't fast food,
Mhm.
dude.
Yeah, no, see, and that's one of the things like on the floor, it's like I'm always really big about this patient's already in my care. I'm already in here doing one thing. If they need to use the bathroom, I'm not leaving the room.
Yeah.
Like I'm just gonna help them to the restroom. While they're in there, shit, I might be able to tidy their room up a little bit.
Mm-hmm.
You know what I'm saying? Or go through and chart more of my assessment before I have to walk back in this hallway and deal with my other seven.
Yeah.
Like
I be
so
telling people, I've had it before where they're on the toilet, they're like they're done. I'm like, hang on, you're gonna have to wait. This person's got to pee real quick. So you already got to the bathroom, you're cleaned up. I'm like, just sit on the toilet, run across the hall, boom, 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 get that shit done, come back over. Like, okay, let's get up now. Like, as long as you're like real with people, with the patients, I think they're like most of the time they're cool
yeah,
with it, dude. Like, I don't know, you kind of feel
okay.
it, but like I said, you do need that's why I like having a tech on there because I'm like, look, I've done this and this and this. I need you to just either watch this person or help them back to bed. Like you don't even got to clean them. You just literally have to walk them back to bed.
Yeah. See, and I love my techs that work hard. So I've had some techs that don't, but I've had a lot of techs that are like, they right there with me. They say, oh, Malik working tonight? We gonna have a
Yeah,
good night. Yes, we are, baby. Yes, we
I'm
are.
telling you, bro. It's just like being like we talked about. It's just being respectful to them, bro, and like showing you that you're working your ass off because they're gonna be like, well, now I kind of have to step up too. I don't know.
Mhm.
Good people attract good people.
Exactly. You know what I'm saying? You go in there with a good mindset. You treat everybody fairly and equally. You respect everybody. You know what I'm saying? There's nothing we can't get done. But like you're saying, we don't have to work in teams like we do in the ED on the floor. Like
Yeah.
yeah, I can sit here and make sure all of my shit gets done and not talk to anybody for a whole shift. But in
Mm-hmm.
the ED, that's a lot harder, right?
And like, there's always like special occasions where like, yeah, you don't have time for it. But I'd say like a lot of the time I'm able to do that. Like, I try to take like if we have to take like the total patient cares, I try to take more than just one if we're like really that short because I'm like, it's no big deal. And I always try to
Mm-hmm.
take like one of the harder ones as my TPC because like if we're gonna make this tech either take all these people by themselves or extend to a bigger ratio, then why am I gonna go give them the hardest fucking patient that takes a half hour every time you're in the room? Like
I definitely feel that. I gave
that's
my
not
tech
gonna
some cake.
help them. That's not gonna help them one bit.
And on the floor, I'm definitely giving cakewalks out because
Yeah,
I will go in here and bust my ass, bro. I don't want you to feel like I'm using you. You know what I'm saying? I want you to be an asset. I don't want you to feel burnt out working with me. Like, I'm not going to do that to you.
because it's only gonna make you not want to come to work the next day or quit, and then we have no
Yeah.
tech. Like I'd rather have
Yeah.
some tech than no tech.
Yeah. We had a lot of times where we would have all these assignments. It would be 1 to 8. There's what, 4 or 5 nurses working, one tech. We're like, okay. So we would literally, at the beginning of the shift, we'll say, like, okay, we're TPC on however many of our team. It's usually like 2 or 3 of our team with total patient care.
Yeah,
And I'm like, okay, cool. I'm gonna give you cakewalk shit because I know you have all these other people to deal with. Like, you're not just dealing with my
and I don't
forward
have
that I
a
give you.
yeah, and I don't have a lot of faith in other nurses to not do that to you either. So
Yeah, yeah.
I've seen
Seeing
it.
your graces, seeing you
Yeah,
dream team. You
yeah.
know.
But what else I got here? Like I think the biggest difference is like the ER is what people don't understand about the ER. Like our job is literally just to stabilize them. It's not to fucking fix them. That's the floor's job. But for some
Yeah.
reason they want you to like tie them up in a bow and put rainbows and butterflies on them and be like, here you go. Like just watch them for 2 days. Like no, it's your
Press one.
job to fix them from there. It's our job to solve the emergency. That's why it's called an
Yeah.
emergency room.
That's one thing I didn't understand until this job. It's like mainly the med management. We're acute. We're in and out. We're getting shit done right now that we can handle right now.
Mm-hmm.
Anything else, we're gonna shift that shit to the floor. You know what I'm saying? We do our best to get as much done as possible, but if it's something that is taken away from the care of my other 2 or 3 rooms that I'm assigned,
Mm-hmm.
I'm sorry. You gotta bite that.
Yeah, and I think, but I think the hospitals do a terrible job at that because that's why there is that civil war that everybody hates each other. Because when I first started, bro, I never even saw the ER. It took fucking friends going down to the ER and then talking to them after of what they're dealing with for me to finally be like, oh, what do you mean you haven't checked their whole body and seen if there's any skin problems? Like, yeah, no, dude, dude's still in street clothes, man. How do you want me to look at him? Like,
See, and I think that's a big difference between adult world and peds world too, though. Because in peds world, we have to do that. We have to strip them and look at everything because there are certain like signs of abuse and things like that. That if you don't take this patient's shirt off and notice the bruise on their belly, like they might really be fucked up internally, and they just have this small bruise on their abdomen. You know what I'm saying? You don't know unless you strip them. So, especially our DOs were really big on that. Like, I'm taking you out the onesie. I'm sorry, it's cold
Yeah.
because I need to look at your rate of breathing, your work of breathing, and I need to check you for bruises all at the same time.
So yeah, I just like I said, and I love listening to both sides because they both think neither one does anything, and they're like,
Yeah.
the biggest one that comes down is like the floor when they're like, what? Why do I have to go pick this person up? And then they're like, I got down there and they're all just sitting there, and I'm like, well, do you think that was like the 2 minutes they had to just finally sit and chart a little bit? And they're like, no. And I'm like, yeah, you
Or
do.
does
You just don't want to say it.
or take patient ups from us? Like we drop them off. If the nurse doesn't have the time to do it, one of us do it. Like
Yeah.
either
Because
the
they just,
ACTs.
yeah, they're like, we want to get this fucker out of there. So send him.
Yeah.
Treat him and
Oh
yeet
no,
him,
they be
baby.
bullshit.
Treat him and yeet him.
They want to get them out of there, bro, but they don't want to clean the room and mark it clean because they gonna get another one. And I be at the thing, I'm looking like I know that fucking room clean. Shit. Sometimes I'll take a patient back, spin around the long way, clean that room, get back to my station, mark it, and take a new one to them. Fuck
Yeah.
them.
Hey, sometimes you gotta play the game, Malik. Okay, sometimes you gotta play the game a little bit.
Sometimes, man. But if I know you bullshitting,
Yeah.
especially when I got 60 people sitting out here in this waiting room, oh, you're seeing somebody. You're making my night long. I'm out here time taking vitals on vitals.
No, dude. It's but yeah, like and then like the ER doesn't get like how much like because I don't know. I feel like down there you can kind of like I won't say ignore people, but you can be like, yeah, I know you need a water, but I'm doing this. Versus like the floor, you really can't say that because like they're kind of like it's almost like it's their home because they're like living there for those days, or that's at least how I see it. So you can't like
Yeah.
because they'll fucking rain, and you really have no excuse besides to go in there like and take care of them or whatever it is. And so like the floor doesn't see that because they're like they like you said like they can skip certain meds. Well, I can't skip these meds. Like I gotta give all these meds, and some of these people are taking 30 pills at 9 o'clock and take them one at a time, and you're like,
Hmm.
come on, lady, I'm about to
I'm about to roll down a
open
fucking
up.
hill.
Just start
Yeah.
shoving them down there.
No, definitely. Especially on the floor and stuff. Like you were saying, like I was really big on telling the patient like what the fuck's going on anyways.
Mm-hmm.
So it's like you need something from me right now. If it's something that can wait, I'll tell you like, look, hey, I'm two doors down from you. I got one patient in between. Let me get through them, and then I'll be in your room for this amount of time. I can do whatever you need me to do.
Yeah.
In fact, you mentioned you need some water. Okay, on my way in, I'll grab that ice water and be right to you. You know what I'm saying? Just give me a second because I have to go do this first. Like
Yeah.
communication fixes a lot of shit.
Yeah, because so many times these people are pissed off, and then I'm like, well, they were doing this, and then they're gonna do this,
Mhm.
and then they have to come, and they're like, well, why didn't they just say that? And I'm like,
Because they don't know how to open their fucking mouth.
I don't know, I'm not them, man, but I'm here now, so like, let's fix the fucking problem. Let's quit bitching about
Yeah. What did
it.
Lauren Hill say? Miscommunication lead to complications? She wasn't lying. Okay.
But yeah, so like I said, like my biggest fix to this would just be like during orientation, you do one day, just go down there. You don't even have to take patients. Like just shadow a nurse. Like wherever she goes, you go, and you just because then you would see like okay, like they're not just sitting around bullshitting like you guys always think. Both sides think. I'm like it's like
The shit's not.
it's like what we talked about. Like everyone's got a story, but you can't let it take over you, and like that's how it is there. Like they just think all the problems are just happening to that floor, and I'm like, have you worked anywhere else? No, and I'm like, well, it's like this everywhere else, in every
Yeah.
hospital, in every country. Like it's all the
I think that becomes more
medicine
apparent when
doesn't change that
floated.
much, you know.
Yeah. When you get people that are floated to different floors than I used to. So like I would get floated down to ED at my last hospital, and I mean I just did lines and labs all night. So it's like I
Yeah,
still get to look around and see the shit that they're doing. You know what I'm saying? But we would have like ER or ICU personnel get floated to my floor, and we're capping them at a certain amount of patients. Like you're getting capped at 4 patients from the ER. You're getting capped at uh capped at 3 patients from the ICU
yeah.
because they don't want to overload you. Like you can't. Not all nurses are strong enough to handle 8 patients like that, even if it is just a med tele floor.
Yeah.
Air quotes on. You know what I'm saying? Not everybody can handle that like that. You
It's a
know?
workload. That's what I mean. It's like a whole different type of busy. Like you have to literally
Yeah.
like manage what these people like. You have to take care of more of their wants, whereas like the ER, like you really only have to take care of their needs. Like
Yeah.
it's nice and you should take care of their wants, but really you just need to get take care of their needs. But yeah, I don't.
Get to looking at them patient satisfactory scores. The floors, okay. That they hate us because they with us for longer. They got more reason to be pissed at us.
Yeah, exactly. And they're pissed about their wait time in the ER. Like I had any control over it. Like did you see me over there? Well, no. Okay, so don't be yelling at me.
I just tell them like, look, I'm very sorry. This is how it works. We're not given specific timelines. This is what I can do for you for now.
Mm-hmm.
You're here with that same problem. I'm sorry. You hungry? You can't eat.
Yeah. But like I think like especially at like our hospital, like it's so big, and honestly, if they took care of that, it would like nurse satisfaction would go up 100% because like that's probably like 50% of the complaints is like floor versus whatever versus the ER,
Yeah.
floor versus another floor. And I'm like, why don't you guys just do like sporting events or something? Like nobody wants to come in on their off day to the Halloween party at the hospital cafeteria.
Yeah.
Why would I want to go to
Hey,
that?
and why do you only throw good parties for day shift?
That's
We
all
don't
right
want
there.
leftovers.
Yeah. I love our team. They come in at, and I've told like there's one person that lives around here. She's on the team, and we've had this conversation, and
uh,
she knows how I feel about it, bro. But I'm like, yeah, you guys know you come at the worst time, right? And then the first time we had the conversation, she was like, "What are you talking about?" I'm like, "You come when we have to pass meds, and when like
hmm
I'm like, and that's the busiest time." And you wonder why
hmm
nobody's like really nice to you or all that. I'm like some of them are because like they don't care to get their stuff done like right away. Versus I'm like, look, I'm trying to get everything done to start up this shift, and I'm like, you're coming in at this time to ask me if I want a bowl of fucking Cheerios and some ice cream. Like, no, the fuck I don't. So that's why I'm always pissed off. And I'm like,
Shit, we were doing a
maybe
workout one night and they came in with donuts. I'm like, yeah, yeah, I want a donut. Sitting on my computer though, because I can't move.
yeah, I'm like, and I'm like, I don't know, dude. Just throw something on my fucking desk. But I have to go. Like, do you not hear this fucking the four dingings down the hallway? Yeah.
Yeah,
So that
bro.
one's. I'm like, just have like sporting competitions, like, and you don't even have to mix up the teams. Like, you can do floor versus floor, but then at least these people can put a face behind the phone. So like, they're gonna be more willing to work with someone they know versus like, oh, who the fuck is this Brianna chick? Like, I'm
Oh,
fucking
they
working
also
with.
less likely to talk shit. Yeah, because now you gonna see them.
Yeah, and now they know you. But and like I said, they just don't even. I don't know. It just feels like simple stuff that they're like just they don't even do. But I'm
Skipping
sure
over,
that's
yeah.
everywhere, dude. But like I don't know. I just think that would be like one of the most fun things. And it doesn't have to be sports. Like you can just make it games, but just something not on the hospital campus because then it still
Yeah,
feels like work.
yeah.
So that's my
Like we gonna
soap
throw
opera for this shift.
for real though. If it's gonna be something, rent out a space. You got the money for it. You know what I'm saying? And the shit don't cost that much.
Mm-hmm.
But like I will say though, working in peds though, they're really big about throwing stuff like that. So sometimes we'll show up, be like, damn, what's going on down there? They're like, oh, come check it out. We got free shirts, free bags, all types of
Yeah.
shit. I'm like, oh
Oh
yeah,
no, we
I
ain't got
like this.
we ain't got none of that shit, dude.
Oh yeah, peds is I ain't gonna lie, it's growing on me.
Oh, I'm sorry, bro, because they fucking throwing a party for all these little kids, man.
That's
That's
exactly what
good
it
though.
is.
Can't hate on
Grown
it.
up shit too.
But yeah, and it's like also like I don't know. I'm kind of jaded because yeah, obviously I'm a drinker, but I'm like, why wouldn't you like have it where people can have a couple drinks? Because almost everybody that works in a hospital or that's like a nurse or a tech, like
Yeah,
90%
majority
of
of
them are over 21.
yeah.
Like I don't know, and maybe they'll probably be like, well, we can't be drinking and working, but I'm like, you can have all these banquets though. You're telling me people aren't
Hmm.
drinking at these big banquets that are getting all this donation money?
Mm-hmm.
Oh
It's just a
shit.
glass of wine.
Yeah, oh shit, Aunt. Yeah, fuck that, dude.
Yeah.
Like that was some of the most fun time. Like during COVID, dude, we fucking ICU would go to and fucking find this bar open at 8 a.m. And then yeah, you have like a couple beers and
I
you
love
go
that.
home, but like you get to decompress a little bit. And I'm like, you can have these two decompress in an open area where they're not pissed off at work. Like they're more relaxed. I
Mm-hmm.
don't know. It just seems like an easy fix to me. But what do I know? I'm just a nurse, dog.
Well, they don't like to listen to us. This is their shit. That's what it is.
Do nurses versus doctors in fucking wrestling or something. Let me beat the fuck out of a couple doctors. That make
Oh,
me feel better.
him.
What'd you say? You were talking to me how?
Yeah,
Fuck out of here.
you like this. Putting all the doctors in a half or a full bucket.
You got anything
Nah,
else?
uh, really, because I'm telling you, the beef ain't gonna stop until we just get together and have some fun.
Mm-hmm. I mean, look, Civil War, bro. That's what they had to do. They had to fight it out, then talk it out, and now look. Now we're all together.
Texas is
Sort
still
of.
trying to secede, sort of.
Hey.
Shit, we could do a Hospital Civil War series. That'd be turned. I'm cool with it.
Fucking
Think about ER versus PICU. Mm. They be on us about wearing our gowns.
Yeah.
How you like that?
Like I said, I just think it gives them a chance to blow off steam in a place that's not work, and then put a face to each other, so that way they actually know who they're working with.
Definitely. That's a really good solution. I mean, I doubt they listen, but yeah.
Yeah. Hey.
Dreamers can dream, right?
Yeah. Well, like always, take care of everybody like you take care of your grandma, and do what you do, baby.
Like, comment, subscribe.